morning, sir. I'm going to perform assessment of administering oxygen via nasal cannula, and we have purposes to deliver low to moderate level of oxygen to relieve hypoxia and to allow an interrupt of oxygen while the client ingests food or fluids. And then we have the preparation and assessment. We have skin and mucous membrane color of the patient and breathing patterns, chest movement, lung sounds audible by auscultating the chest by the ear, presence of clinical signs of hypoxia, anxiety, decreased level of fatigue, dizziness, inability to concentrate, dysrhythmias, pallor or cyanosis or dyspneas. First, we have to check the lungs. Check the lung sounds of the patient. And then we have to do the planning. By planning, we have to assemble and prepare all equipments and appropriate oxygen delivery system, nasal cannula, simple oxygen mask, concentration 40% to 60%, oxygen source, flow meter, no smoking sign, and humidifier and distilled water. And here our no smoking sign, our flow meter, oxygen tank or oxygen tank or oxygen delivery system, and then we have the flow meter and the humidifier, and we have nasal cannula and the tape. First, we have to review the client's records in order for us how to we know how many or what will administer to our client. And then we have to wash our hands by using soap to prevent any infection procedure or use alcohol. And then we have to identify the clients and with 5 rights. We have the right patient, right drugs, right dose, right route, right time, right approach, right evaluation, right motivation, and right documentation. And then we have to explain the client procedure, and then explain that oxygen will ease dyspnea or discomfort and inform the client concerning safety precaution associated with oxygen use. Then we have to assess the client in a semi-Fowler position. Then we have to insert the flow meter into the wall outlet oxygen tank. Here we have to insert the flow meter into the wall tank. This one po. And then we have to attach the oxygen tubing to the nozzle on the flow meter. There we have to attach the tubing to the nozzle of the flow meter. This one po. And then we have to attach the oxygen tubing to humidifier if using a high O2 flow. We have to attach the tubing of the humidifier if we are using high O2 flow. This one po. We have the humidifier, and then we have to attach the oxygen tubing. This one. Then we have to turn on the oxygen, this one, to at the prescribed rate, and then we have to check the oxygen in the following and flowing through tubing. By checking the oxygen by flowing into the tubing, we have to put near the wrist or near the skin to be able to notice if the oxygen is flowing. Hold the nasal cannula in a proper position with prongs to the nearest downward, curving downward. And then wrap the tubing over the and behind the ears. Place gas at ear beneath the tubing as necessary if the prongs dislodge from the ears. Replace promptly. Then we have the evaluation, and we have to assess for the proper functioning of the equipment and observe client initial response to the therapy. And then we have to monitor continuous therapy by assessing for pressure areas, um, on the skin and nails every 2 hours, and rechecking flow rate every 4 to 8 hours. And then perform the follow-up based findings that client relate findings to previous data if available. Identified unexpected outcomes, recording and reporting. Record and report all patients' information procedures, recorded pre-procedures and post-procedure via vital signs. Documented evaluation of patients for caregiver learning.